Namaste. A very warm welcome to all my junior colleagues and medical students joining us today. I am genuinely so glad you're here for this explainer. Every single year, right around admission season, I have young doctors walking into my cabin carrying the exact same heavy weight on their shoulders. You're looking out at this medical landscape, and honestly, it's shifting faster than we've ever seen. You just want to know what the future of your career actually looks like, right? Well, today, we're going to guide you through this, step by step, and we're going to base this on the actual realities of medical AI. No science fiction here, just the hard facts.
So here's our agenda for today. We'll start with the big AI question, move into AI's true medical strengths, and then we'll map out shifting medical specialties. After that, we'll explore emerging medical roles, and finally, look at future-proofing your career.
Section 1. The big AI question. So many of you come up to me and ask, "Sir, which branch should I choose? What's the scope of this specialty compared to that one?" But I know what you're really asking underneath all those words. You're thinking, is AI going to take my job? And listen, it is a completely valid anxiety. You're about to dedicate 3 exhausting years to a postgraduate residency, and then decades more to building a practice. You absolutely need to know if a machine is going to make those hard-earned skills obsolete. So let's tackle this reality head-on today. I'm not here to just pat you on the back and hand out false reassurances. I want to give you the honest, real picture.
Section 2. AI's True Medical Strengths.
Okay, to cut through all the media hype, we first have to demystify what artificial intelligence actually does well in a clinical setting right now. If you look at the left side, AI is absolutely brilliant at narrow, well-defined pattern recognition. You hand it a chest x-ray, a pathology slide, a 12-lead ECG, or maybe a diabetic retinopathy scan, and its accuracy is already right up there with our highly trained specialists. It has this incredible cold precision. But shift your attention to the right side. What is AI still really struggling with? It's the messy, ambiguous, multi-system reasoning that real patients bring into our OPDs every single day. AI really struggles with that 70-year-old patient who walks in with 5 different comorbidities and a clinical story that, let's face it, just does not fit neatly into any textbook chapter. That huge gap between simple pattern recognition and complex human reasoning, that's not closing quickly.
Section 3. Shifting medical specialties. Now, understanding those specific strengths and weaknesses actually helps us predict exactly how our beloved branches of medicine are going to evolve. Take a look at radiology, pathology, and screening fields like dermatology. The routine volume of work in these fields, that's going to significantly shrink. But, and this is absolutely crucial, the doctors do not disappear. Instead, their role completely shifts from merely detecting basic abnormalities to interpreting the highly complex, ambiguous cases and providing vital input on tumor boards. Next, look at surgery and critical care. Sure, AI can flag a lesion on a scan, but it absolutely cannot scrub in to do a bypass or an angioplasty. Because these fields are built on hands-on procedures and managing unstable patients in real time, their scope is actually expanding. And finally, general medicine, psychiatry, geriatrics, and palliative care. AI is going to happily absorb the routine diagnostic work and all that heavy documentation. And honestly, what a blessing. It frees you up to focus entirely on judgment calls under uncertainty and building those deep human relationships, which remain irreducibly human.
Let's zoom in even closer to home. For those of you leaning toward internal medicine, we really need to do a deep dive into how the subspecialties are fracturing and adapting to this new technology. This brilliantly illustrates the nuance of what's happening. Take endocrinology. The high-volume, routine stuff, like standard diabetes and thyroid management, that's increasingly going to be managed by general physicians using AI-assisted tools. So pure endocrinologists, they're going to shift toward a very complex, referral-only kind of practice. Nephrology, on the other hand, holds completely steady. Why? Well, because managing dialysis, transplants, and acute acid-base emergencies is highly procedural and incredibly high stakes. Medical oncology is actually moving in the exact opposite direction. With all these new drug classes, immunotherapy, and genomic-guided treatments, the field is getting so complex that it's pushing toward even finer subspecialization, like specializing by specific cancer types. And hematology? It splits right down the middle. Benign hematology becomes easily managed by general physicians with AI tools, while malignant hematology becomes even more strictly specialist-dependent.
Section 4. Emerging Medical Roles.
We have to remember that technology doesn't just change old jobs. It opens the doors to entirely new career paths that literally didn't even exist a decade ago. These are the futuristic roles some of you are inevitably going to step into.
Like clinical informatics, we're going to desperately need physicians who can validate and oversee AI tools within our own hospital networks. Then there's genomic and precision medicine. Specialists are going to be needed across all branches to interpret these incredibly complex genetic and pharmacogenomic reports. How about telemonitoring physicians? They'll be managing patients using continuous data flowing in from wearables and home sensors. Think about how genuinely game-changing this is for our massive catchment areas here in India. A patient traveling from a rural village to a Tier 1 city just for a routine follow-up is a huge physical and financial burden. This solves that. And finally, AI auditors. This is a very new area, but an absolutely critical one.
I want to pause on this point specifically. The need for AI auditors is a hyper-local, critical requirement for us. Why? Because an AI model that's been trained predominantly on Western data might not perform safely or reliably on our Indian patients. Think about it. Our demographics, our genetics, the way our diseases present, they differ. We absolutely need highly trained local physicians to audit these tools for performance and safety before we even think about letting them loose in our wards.
Section 5. Future-proofing your career.
We've looked at the landscape. So how should a young, bright doctor actually go about making their specialty choice today? Well, here is my earnest mentorship advice to you, laid out in 3 simple steps. First, please do not pick a branch just because it looks AI-proof today. Pick it because you have a genuine curiosity for it. Real clinical mastery takes 30 years of sustained, daily engagement. That passion is literally the only way you'll ever reach the unautomatable parts of any field. Second, you've got to get comfortable with AI tools straight away, regardless of which branch you choose. You have to start treating AI as a basic clinical skill. You know, for my generation, the big shift was learning how to read an ultrasound. For your generation, it's mastering AI. And third, always weigh India's actual disease burden over whatever global tech trend is making headlines on social media today.
Let's ground your strategy in stark reality. Just look at the driving disease burden right here at home. We are talking about diabetes, chronic kidney disease, cardiovascular disease, and a rapidly aging population. These local health crises are going to drive a massive, frankly overwhelming medical demand for decades to come, completely regardless of what AI can or cannot do. Fields like geriatrics and palliative care, they're going to see a huge surge in importance. Trust me, if you align your skills with the actual suffering of the people, you are never going to be out of a job.
I want to leave you with this core thought from our source material today. Just listen to this. Information is now cheap and available to anyone with a phone. Judgment, empathy, and the willingness to take responsibility for a decision are not. That is the absolute truth. That is exactly where our true value as physicians has always lived, and is exactly where it's going to continue to live, AI or no AI.
So as we wrap up this explainer, I want to leave you with a bit of a provocative question to ponder. When AI makes medical information completely cheap and universally accessible, are you preparing yourself to provide the high-level judgment and the deep human empathy that your patients will truly need from you? Don't be anxious about the machines. Focus on elevating your humanity, your clinical judgment, and your empathy. Thank you so much for joining me today. Keep learning, keep questioning, and I'll see you in the next explainer.